JKPSC 2026 Medical Officers book. And we get a lot many queries from the students how to prepare the examination, what is the strategy, what are the most frequently asked questions, and what are the tips for preparing this examination. Now, as far as this project is concerned, we have got this book, JKPSC Medical Officer Quick Review Book. And you are well aware of the fact that there is a syllabus which is given in the JKPSC group. Now, our authors, Dr. Munib, Dr. Irshad, and myself have collaborated together to form this book and to see that it benefits you to the maximum extent. Now, as far as this JKPSC book is concerned, it is complete. I mean to say that we have prepared it as far as the syllabus is concerned. You are well aware of the syllabus of the JKPSC Medical Officer exam and what are the important things which are asked from this exam. And here we have to be very much precise what are the topics which are frequently asked. So we have given a complete list of the topics which have been asked previously, what might be in the mind of the examiner, and what you expect in these examinations. So, you yourself being trained in MBBS, you are well aware that this is an examination for the medical officer. So, what do you expect from a medical officer? The questions usually should be asked in that manner. But as far as the last previous year's questions are concerned, there have been a big number of questions, large number of questions asked from things which do not suit the medical officer examination basically. So you have to have some basic fundamental knowledge that would help you. A good student who has a basic fundamental knowledge would fare better in some questions, and this examination is not exactly only about medical officer examination. Let me be very clear about it. So, though we have got the main brunt of the questions from medicine, surgery, gynecology, obstetrics, you are well aware of this thing. And we have over here given a compact list of the things which are asked. So, for example, we take the example of general surgery. And general surgery, you can see that there are questions which have been asked on wound healing, the basics of fluid and electrolyte imbalance, the infections, the wound infections, the surgical site infections, the tumors, the skin diseases, the arterial diseases, some of the conditions from the pediatric, cleft lip, cleft palate, the thyroid anomalies which you get, say goiter, which you see in the field in the northern regions especially. Then diseases related to pancreas, acute pancreatitis, chronic pancreatitis, pancreatic CA, diseases related to GIT, esophagitis, esophageal carcinomas, benign lesions, the gastrointestinal tract, the polyposis syndromes. So covering so many things, the range of the things which exist there. So, as far as the questions are concerned, let me tell you again medicine. Now, we take medicine, and medicine, we get questions from cardiology, we get questions from gastroenterology, we get questions from hepatology, we get questions from endocrinology, hyperthyroidism, acromegaly, cretinism, thyroid malignancies, follicular, papillary, Hurley cell, anaplastic, lymphoma, thyroid. So, a whole range of questions. And the questions do not test only about the, I mean to say, the disease aspects, the clinical diagnosis. No, they ask you questions about the genetics as well. So, genetics and other aspects as well. Now, going back to one thing, that what are the topics which you have to prepare? There is anatomy, clinical anatomy, there is physiology, and we sometimes do not focus much on that, but these happen to be very, very important subjects because we see a big number of questions being asked from physiology as well, because physiology is the fundamental of medicine. The whole concept of medicine is derived from physiology. So many questions from anatomy, so many questions from physiology. Now you would say forensic medicine. Now you had those legalities, you have those IPC sections, you have those procedures in the code, the criminal proceedings, and the I mean to say the judiciary involvement, as far as medical officer is concerned, you get so many things as far as the legalities are concerned, the poisonings are concerned, different types of poisonings. I mean to say strychnine poisoning, I mean to say arsenic poisoning, I say mercury poisoning, and then you get those cases of sexual assault, so many sexual perversions, which are very important from a forensic perspective as well. So my point is that you have to be well versed with the basic knowledge of MBBS, what you have studied in the books like I would not name some books. So basic fundamental books, standard books, which we consult for these subjects. Then again, as far as this subject is concerned, the preventive and social medicine, this is a very important subject, and many questions. It's a major subject as far as your PSC is concerned, and you get these questions in the form of vaccination, which are live vaccines, which are killed vaccines. What is the immunization schedule? What are communicable diseases? What are non-communicable diseases? You get so many things about these things. They are very important topics. Tuberculosis, some of the pediatric conditions like measles, mumps, rubella, congenital rubella syndrome. I see a large chunk of questions being asked from these topics. So, as far as I mean to say, the questions from social and preventive medicine are concerned, they focus on primary prevention, secondary prevention, tertiary prevention. There are these diseases like obesity, polycystic ovarian disease, some of the things which can be prevented. I mean to say waterborne disease, vector-borne disease. You have to have those knowledge about the mosquitoes. You have to have this knowledge about the various important rickettsial organisms, the viruses, the diarrhea, the rotavirus, the Norwalk virus, the outbreak of cholera. I would say a whole range. These are the focus. This medical officer examination is about the focus on these specific topics mostly. Then comes statistics. Now, statistics, as far as statistics is concerned, we have got I will just go through the statistic part of it. So you see, we have got what I was telling you. We have got those things like the polygons, the bar graphs, the histograms. Then we have got these terms about the standard deviation, 1 st, 2 st. Then we have got these cohort studies, case control studies, students unpaired t-test, what is chi-square test, and so many things like I mean to say positive, what is a, I mean to say correlation fraction, what is the coefficient of determination, what is the coefficient of variation, so many things. These, I mean to say, you have to distinguish between different types of studies in statistics as well. So then the variables, the nominal, the ordinal variables, these are very important, as the mean, the mode, the median, the standard frequency, what we mean by all those things. So SPM and statistics forms a very important part of the JKPSC exams. Now, as far as pharmacology is concerned, once we study about medicine, about the different branches which I enumerated, the gastroenterology, the hepatology, the endocrinology, what are the drugs which we give in diabetes, what are the drugs which we give in PCOD, what are the drugs which we give in, I'm saying main focus, tuberculosis, very important, anti-tubercular drugs, anti-leprotic drugs, then some of the malignant conditions where we give chemotherapy regimes, so side effects of these regimes. The questions asked are based on this. Physician prescribed dash drug. What is the most likely side effect of this drug? A patient came to a PSC. He was prescribed dash drug. So he developed a side effect of this drug. What is the mechanism of action of this drug so that it causes this side effect? What were the metabolites involved in the causation? So things about these. Then we have got this important subject of gynae ops. And in gynae ops, you just go from basics, pregnancy, the complications of the pregnancy, the values which get altered within the pregnancy. Then we also have, I mean to say, that the conditions preeclampsia, eclampsia, placenta previa, placenta excerta, placenta percerta, various abnormalities of the placenta, placentation. Then we have got inversion of the uterus, rupture of the uterus, contraception, very, very important. So many questions on contraceptives, hormone replacement therapy, the benefits, the adverse effects, side effects of OCP, what are the methods of contraception, different types of contraception methods, all there, all there. I mean to say that these are very important. Then the important about the gynecological malignancies, the cervical, the vaginal, the uterine malignancy, the screening of the cervical, the cone biopsy, I mean to say the cervical smear and all those things, the carcinoma in situ cervix. So many questions asked, and the role of vaccination in prevention of carcinoma cervix, HPV, and all those things. Causative factor, the sexually transmitted diseases, trichomoniasis, bacterial vaginosis, so many things which are asked. So this is something which is now, as far as I mean to say, the surgery is concerned, and surgery we get questions ranging from any condition, right from the burns, the treatment of the burns, the management of the burns, the management of a patient who is severely, I mean, say, in a state of shock due to multiple causes. So then the malignancies, as I mentioned, of the hepatobiliary tract, the genital tracts, the prostatic malignancy, the RCC, renal cell carcinoma, then the malignancies of the gallbladder, the pancreatic malignancies, adenocarcinoma pancreas, adenocarcinoma gallbladder, adenocarcinoma stomach. So many questions, the gastric malignancies, the types of different malignancies. So that is also important as far as then we do not underestimate pediatrics and neonatology, because pediatrics and neonatology questions asked from a clinical perspective, like the syndromic entities like the Downs, Edwards, Patus, I mean say, then the metabolic disorders, Von Gehrig's, Pompe's, Corey's, McArdle's, Anderson's horror stories, so many diseases, Hunter's disease, Shy's disease, Tay-Sachs disease. These are important focus. Then in addition to that, some of the important clinical conditions, infective conditions, meningitis, encephalitis, gastroenteritis in pediatric age group, appendicitis, so many things which come, I mean, say, other conditions mimicking appendicitis and all those things in children, and some of the important conditions as far as neonatology is concerned. I mean, say, you go to the basics of genetics and some disorders like anencephaly and all those things. So you get the genetic part as well, the pathological part as well, the clinical part as well. Say they give an example of a patient with features of low intelligence, hypotonia, umbilical hernia, so ventricular septal defects, so Down syndrome, you can make it from there, Simon Crease, isn't it? So many things. So they give you the questions in the form of clinical scenarios. So as far as the medicine is concerned, medicine and allied, it is not medicine only, because you get so many questions from diseases like hepatitis A, B, C, D, all those things, the treatment modality, I mean to say, then you get conditions like hematological malignancies, lymphomas, the leukemias, a whole range of questions. Then nephrotic syndrome, nephritic syndrome in, I mean to say, in medicine. And then endocrinology, I told you, get so many questions about hypothyroidism, hyperthyroidism. So these are the basic questions which are asked. And what is important is that you're focused, because you have got very few days left for your exam. It is not that you have got months of preparation for an exam. So the thing is that you cannot at this point of time revise big books, big textbooks. So fundamentally, I have given you the jkpsc I mean say book, in which the explanations are precise, concise, and the explanation in themselves answer many of the questions. So what I would recommend you at this point of time is not to overload yourself, not to confuse yourself. The thing is that you need to have a study material, have a basic background knowledge, apply that knowledge on the day of your examinations, and this JKPSC book will be of some benefit to you, I hope. Make a good effort, and the rest of it, you to Almighty. I wish you best of luck for your exams. Thanks a lot.